Hi, welcome to Tag Physical Therapy's mini wellness workshop. I'm Megan Golden, physical therapist. Today we're going to be talking about telehealth, or what's sometimes referred to as telemedicine. Telehealth is when you can access your healthcare through a live video conference from the security and privacy of your home. The telehealth online platforms protect your health information and keep all of your important information private and secure online. Many people are curious about what a telehealth session might look like for physical therapy. Today, I've teamed up with my colleague Lily to show you from her perspective, playing patient, what it might be like to interact on your computer with the physical therapist for a live video conference telehealth session. Come take a look with us.
Okay, so I am going to click on this link that was sent to me in my email. And that takes me to the Doxy waiting room, and I can just write my name to check in and let her know that I'm here. And then all you have to do is sit and wait until your therapist brings you into the telehealth call. There we go. Hi.
Hi.
How are you?
Good. How are you doing, Lily?
I'm good, thank you. Nice to meet you.
You as well. I'm Megan Golden, and I'll be your physical therapist today. Glad you're here.
Thank you.
Yeah. So as we get started here, I just want to make sure that you can see me okay and that our connection is clear. Is everything all right from that standpoint?
Yeah, it's very good. Thank you.
Okay. Terrific. Good. Also, I'd just like to get your verbal consent. Is it okay with you today to have a telehealth physical therapy appointment?
Yes.
Great. And also, would you agree to hold me harmless in the event of any technology failures today?
Yes, I understand.
Hopefully, we won't have any of those. So.
Yes.
Okay, terrific. I did get your paperwork, and so I do have a sense of what's going on.
Mm-hmm.
But I'd also like to hear from you a little bit about how you're feeling and what I can do to help you.
Okay, sounds good.
So why don't you tell me a little bit about what's going on?
So I just have some neck pain that's been bothering me for quite some time. It's mostly in the back right side of my neck, like right where my head meets my neck. And it tends to represent as like a throbbing pain, and it's not always there, but it frequently comes on more at night or more in times of stress and stuff like that. So recently it's been coming on a lot. It depends on kind of like how tired or stressed I am that day or how long I've been on a computer or something. But it is a pain that can almost always be helped by Advil.
Okay.
So, yeah.
It feels better with Advil. Maybe feels worse with certain activities like being on the computer or the end of a busy day or something like that.
Exactly. And I don't want to rely on Advil every day, which is why I've come to you.
Right. That's understandable. Okay, great. All right, so next up, we're going to take a look at some of your movements. I might take a look at the standing and just look at your alignment, your posture, and then look at some movements, and you can let me know how you feel with those movements as well. Does that sound good?
Yeah.
Okay, great. I'm going to take a look at a few movements.
Okay.
So the first movement is going to be side bending of your head, where you're going to tip your ear towards your shoulder. So it looks like this.
Okay. Either side?
Yeah, either side.
So just like that?
You can just let me know how you feel with that.
This feels fine.
Okay, terrific. How about the other side?
Also fine.
Okay, good. And then just turning to look over your left shoulder.
Okay.
And turning to look over your right shoulder. Good. Okay, so what I'd like to do is show you a couple of things that you can do at home to help take care of this, including some self-care techniques around posture and sleeping position, how you sit at the computer, stretches. Does that sound okay?
That sounds great. Thank you.
Okay, terrific. So let me show you the first stretch that we can try. You can let me know how you're feeling as we do this, okay? All right, so we're going to sit up tall. This can be done sitting or standing.
Okay.
And you're going to move your shoulder blades back and down a little bit.
Okay.
So when you're sleeping on your back, you want to just use one small pillow or something that gives you some support right under the neck, but that doesn't really push your head forward too much.
Okay.
It could be helpful to use a heat pack around your neck for about 15 or 20 minutes at the end of the day.
Okay.
If you'd like, I could send you some ideas for a heat pack that you could buy online and have
Yes,
delivered.
I would appreciate that. Yes.
Okay, great. So you could try these exercises every day in
Okay.
the morning would be a good way to start.
Okay.
You can also use these as a stretch break if you're sitting at the computer doing some work. It's a nice way to take a break and stretch out and give some relief to that area.
Okay.
Um, you can also reach me on email if you have any questions about anything that you've done that I've advised you to do. Do you have any other questions for me today?
Let's see. I guess if I feel the pain coming on and I don't want to reach for the Advil, do you think in that when I'm already having the pain, do you think that stretch might help? I know it might not necessarily get rid of it, but it wouldn't be a bad thing to do that stretch while it's hurting, correct?
Yeah, it wouldn't be a bad thing
Okay.
at all. As long as it doesn't aggravate your pain.
Okay.
If you try it and it feels worse, then you can stop.
Okay.
But if you try the stretch and the pain remains the same or improves, then of course you can keep going with that.
Okay.
There is one more idea I have for what you could do for that area.
Okay.
You do a little. I could teach you a little bit of a self massage technique for that muscle.
Okay.
Okay.
Yeah.
So Lily, do you have any other questions for me today? Anything else I can answer for you?
For now, I think I'm okay. I think I'll try those stretches and those ideas that you had, and then check in next time.
Sounds good. So I'll be sending you out an email that has exercise videos of the things that I've instructed you in today.
Okay.
You can always reach out with questions anytime.
Great. Thank you so much.
You are so welcome. It's great to meet you, and I'm so happy to be able to help you.
Great. Thank you. I look forward to seeing you next time.
You too. Thanks, Lily. Have a great day.
You too. Bye.
Bye.
We hope you found this video about physical therapy telehealth informative and useful. Please contact us with any questions you might have about in-person or telehealth physical therapy appointments. It's been a pleasure talking to you today. Hope to see you next time. Thank you.